Welcome to Wellness by Designs. I'm your host, Andrew Whitfield Cook. And today we have a great treat for you. We're joined by both Lara Briden and Kira Sutherland. And today we're going to be talking about optimizing metabolic health for women. Welcome to you both. How are you?
Hi, good morning.
Good to see you.
Guys, thank you so much for taking time out of your busy lives to join us today. I realise how busy you are. But I think first, if I can ask you, Lara, just how big a topic is this in today's society?
Well, really, when we say metabolic health, we're referring to the problem of metabolic dysfunction or insulin resistance or pre-diabetes. Conservative estimates are that it affects at least 40% of adults. So that is quite a big problem. And a lot of people, of course, don't realize that they have insulin resistance, which is part of our work around this is raising awareness and helping people to understand the signs and symptoms.
So, Kira, can I ask you then, if we talk about these insidious signs and symptoms, what should we be first looking for, even before people present to clinic?
Oh gosh. What a great question. What should we be looking for? There's just so many signs and symptoms. I just think anybody not feeling optimum, a sluggish, weight gain, we will go into hormone balance as well, but just anybody needing to be aware of what's going on with our body. I don't even know if I have Lara, set signs and symptoms you want to.
Yeah. I would say the classic sign of insulin resistance is feeling hungry all the time and being more prone to episodes of hypoglycemia or low blood sugar, which is kind of counterintuitive, I've realized, because a lot of my readers and patients think, well, okay, insulin resistance, pre-diabetes, so that must mean high blood sugar. But actually, blood sugar can be normal in the early phases of insulin resistance. It can even be low at times. And that's from the metabolic dysfunction itself, sort of not being able to have this steady supply of energy, supplying the cells with energy. So people get blood sugar crashes and have to eat snacks just to kind of keep their energy up. That's a classic sign. Other common signs and symptoms are elevated cholesterol. You can get sort of changes in liver function tests, mild ones. If a doctor has ever mentioned fatty liver, that is almost always insulin resistance. Not always, because of course there are other causes. But again, I've talked to many patients who have been told they have fatty liver. They're quite puzzled by that. They don't understand that that's actually related to a metabolic issue. And then of course, weight gain, but specifically the weight gain around the middle or the visceral fat, that apple-shaped weight gain. And it's important to say that it is possible to have insulin resistance, but have a fairly normal body size. And conversely, it is also possible to have maybe a higher BMI, such as would happen with like a strong, what's called gynoid shape or hip bum weight shape that women can get. Women can have that and actually be relatively metabolically healthy. So it's not synonymous with weight gain, but yeah, you can tell I'm quite passionate about insulin resistance. I think it's
yeah. Well, there's so many questions that stem from that. So forgive me if I'm going to forget a few. But firstly, one of the things I wanted to just ask you about, and I'll ask you, Kira, was women overtaking men with cardiovascular disease. This has been seen since the 1980s, I think, but you've also spoken about the paucity of good research on women. Yes. So is this a case that women weren't researched, or are we really truly seeing a flip, an increase in cardiovascular disease in women over men?
That's a great thought. Look, I think it's both. We have, women are cardiovascularly, is that a word? But our cardiovascular system is quite protected until perimenopause. And then when we're starting to lose hormones, we lose a lot of that protective buffer that the hormones gave us. So the cardiovascular risk greatly increases once we're hitting peri and menopause and beyond. There is risk before that. More genetic and lifestyle, but we're very buffered because of hormones. So the big risk then comes when peri hits, and that is half of women's lives. They're now going to be at greater risk. So we don't have the same risk as men until we start losing those hormones, and then we have quite great risk. And then the issue becomes, we haven't researched women, especially in cardiovascular risk, but we haven't researched women nearly to the level of men. And so we also don't recognize a lot of the early signs and symptoms. We don't recognize like women presenting with heart attack or myocardial infarction. It can be a totally different set of symptoms which get dismissed even in emergency. Yes. Or with ambulance or just by general people. They almost can have these predronal symptoms for a few days while things aren't going well. And so there is a lot of education now around what the different symptoms can present. But again, it goes to the idea, or, it goes to the fact that women through all stages of life have a lot more, I don't really want to say medical gaslighting, but a lot more dismissive symptoms that we're told just to live with it, or that's normal, or your pain, just deal with your pain when things are getting pretty bad. So I think it's a coupling of everything for them. And then we have insulin resistance coming, and then it increases cardiovascular risk on top of that.
What you said just sparked anger in me, because I have actually seen this. Women being told it's all in your head. We know the endometriosis story. It's all in your head. Actually, no, other end of the body, mate. But I've seen, just so that you know, I've seen women doctors dismiss women for this, and it's just, I'm befuddled. But anyway, Lara, you had something to add to that. Forgive me.
Well, I was just interested. So did you have some statistics suggesting that overall heart disease is increasing in women? Because one thing, and I haven't seen those numbers, but one factor is smoking, right? Like men used to smoke a lot more than women did. And so the quitting smoking collectively as a society has changed some of the numbers around cardiovascular disease.
Right. So the stuff that I'm going off, I mean, I was looking at even things from Cedars-Sinai. I haven't looked at the Australian Institute of Health and Welfare, AIHW, but I do remember reading something years ago that women were overtaking men in certain types of heart disease. Now, whether that was cardiovascular disease, I'm not sure. But Cedars-Sinai attributed it to the introduction of women post the 1980s into the in equivalent amounts in the workforce. And I think it goes much further than that. But anyway, I think that's only one small.
It's the late 80s and the early 90s when we started actually allowing women into clinical research in any number. So the I'm making an assumption here, but the likelihood is our stats were probably higher than we ever knew. But, life's too dangerous for women to be in clinical research, or it was. And depending on what country you're in, there still are or are not laws around the inclusion of women in research. We are getting a lot better, but it's not. Some countries just have guidelines, not laws.
Yeah. Lara,
Australia,
if I can
I'm
ask you.
at you.
Yeah, absolutely.
Yeah.
Lara, can I ask you, you mentioned a few of those early symptoms of glycemic dysregulation, and whether it be normal, elevated or depressed with their glycemic measurements, that smacks of what we see in Hashimoto's, where, the gland that we're dealing with is an efficient pump, if you like, an efficient producer of the hormones. And so damage doesn't really get to be 100% until a whole lot of the gland is damaged and there's only a certain portion left. Similarly, in the thyroid gland, it can sort of take the load, if you like, during the damage of Hashimoto's. So you can go have elevated thyroid hormones, depressed thyroid hormones, or they can present as euthyroid until a certain point. Is that what we're seeing? Is it that the pancreas, what are we talking, alpha cells, beta cells, are being damaged and we only see the full metabolic dysregulation when a lot of those cells have been damaged?
Broadly, I mean, I think the concept you're talking about is this idea of metabolic reserve, that there's some resiliency built into the system at first. And as it starts to fail, then you get kind of less ability to maintain homeostasis, for sure. I think one difference with that from thyroid, though, is a key part of insulin resistance or metabolic dysfunction is actually what's happening in the cells and the mitochondria and the cells that are receiving the insulin signal are supposed to be receiving the insulin signal. And to be fair, that's a factor in thyroid disease as well. You can certainly get some degree of resistance to thyroid hormone, but it's not analogous in that, I don't really think about the pancreas so much. In fact, I don't even sort of talk about the pancreas so much in my latest book on metabolic health. I'm talking more about the mitochondria, the cells themselves, a lot about the liver and all the other organs that are responding to insulin and that are also working together with the pancreas to try to control blood sugar. But yes, you're right. In terms of what you described, like the dysregulation of blood sugar is end stage. Like there are much earlier problems with insulin resistance, including a lot of inflammation and just including the chronically elevated insulin itself that's causing problems really years before blood sugar goes out of range.
You mentioned inflammation there. Can you talk to us about that, about what role it plays?
Well, the state of being in insulin resistance or being metabolically inflexible is a state of inflammation. It's bidirectional. So chronically elevated insulin creates inflammation to some extent, and also underlying other causes of inflammation can create insulin resistance. I'll give an example that would be interesting to as naturopaths, because of course, everything always comes back to the gut. So there is quite a bit of research. Andrew, I'm sure you would have come across the term metabolic endotoxemia before. I think that's a really important one. This is about essentially the LPS, like the endotoxins coming from the gut via intestinal permeability, inducing insulin resistance in the rest of the body, in part by the way it inflames the visceral fat directly because it's in close proximity, the intestine's right there. And then, of course, it affects downstream from that, it affects the liver and it affects the body's ability to respond properly to insulin, to metabolize energy properly. And how many of us clinicians, there's 2 patient stories in my new book about metabolic health, where you fix the gut and then their sugar cravings just go away. I mean, one of the patients is someone who she knew she should stop having sugar. She was really craving sugar. Like she was trying to mentally make these changes. And I was like, well, let's just wait, because you do have SIBO and intestinal permeability, or in one case, you have blastocystis going on, parasites in the gut. So let's focus on the gut and then see what happens. And that is a good example of how dynamic metabolism is, metabolic health is. It's not in a separate compartment from the rest of health, right? Like it's affected by gut health, it's affected by hormone health, it's affected by the nervous system in a big way. It's probably ultimately controlled by the nervous system, actually. I would say even more so than, say, by the pancreas. It's a very dynamic part of our health, and it goes very deep, right to the level of the mitochondria, which is why there's so many, just so many factors, so many interconnections.
Yeah. Kira, can I ask you then? You deal with a lot of athletes, and exercise is an important component in metabolic health. Talk to us about how important exercise is, how important exercise is, how does that tie into inflammation or managing inflammation? Like people who over-exercise, for instance, or try to keep up with somebody who's at a higher level of exercise and they just get inflamed.
Yeah.
And yet there's that concept that some stress is good, even for our mitochondria.
Yeah. Oh my gosh, that was like 5 questions. So, and Lara,
Sorry.
if you want to come in on the inflammation one. Exercise is, I mean, we know how important it is, but especially in insulin resistance or metabolic inflexibility, if we're saying, you know, yes, we need the body to be in this healthy state. We need the right nutrients. We need that gut health and decrease the inflammation, support the nervous system. All of that holistically comes into play. But unless you have or are working on fitness, you are not, oh my gosh, so many things. You're not stretching the cardiovascular system, but you're also not creating mitochondria. We got to remember mitochondria are residing in all of your muscle cells. You know, there's millions of them, but unless you're building muscle or maintaining muscle, especially as we age, we are drastically losing mitochondria, and their ability to function can decrease as well. So it's, you know, oh my gosh, there's so many things to be done there, working on mitochondrial health, in building muscle, actually doing, you know, the big thing, again, this is, you know, women once they hit peri and beyond, but really it's for everybody. We're realizing how important doing weights is over constant cardio or high thrashing cardio. You know, people doing HIIT classes all the time, hoping they're going to burn fat. It's, yes, hypothetically that's working, but only to a degree. And then overtraining, creating too much stress on the body, creating too much inflammation. There's that fine line between how much exercise is optimum versus too much. And it's different for each person, male, female, different body shapes can cope with different volumes of stress as well, we're finding. So there's that whole, oh my God, it's a whole spectrum of what's working for your body might not be working for somebody else. But the more we're exercising and creating, you know, mitochondrial biogenesis, the better we are for maintaining the right physique that we're looking for, optimum physique, because it's more engines to burn more fuel. People often forget the only place we're burning fat in the body is inside the mitochondria. So we need healthy mitochondria and able to allow, you know, both fat, carb, and protein burning, which is a big thing. And if we're unfit, if we're low in muscle, if we're insulin resistant, the problem is with insulin resistance, or the issue is you at a lower level of fitness, lower, you know, issues with insulin, we will pop into carb burning. I'm being very unscientific here, but you pop into more predominant carb burning quicker, the less fit you are. So it's also the slow process for people as they gain fitness and mitochondria health that their engine will start to burn better, but we need to give it time. And if we're going too high intensity all the time, we're not, yes, it's great for the body, but we're not assisting, we're not slowly getting the mitochondria to do a better job.
Yeah.
I hope that made sense.
Lara, have you got anything to add to that? I just want to ask a question about types of fat.
Yeah, well, I was just going to, 2 things. So in Kira and my upcoming webinar for practitioners about metabolic health for women, we are going to talk about different body types. Pretty much what Kira just touched on there, like different body, not just shapes, but I would say different nervous system types, different metabolic types, really. People do better with different types of movement. So some people love that kind of high intensity, rapid sort of movement. Some people are going to do better with the slow strength training or, you know, the walking. And it's a lot to do with the nervous system. So we're going to explore that in some detail. I'm really looking forward to our usual back and forth when we do our duet style webinars. We have fun together, sharing our knowledge. And then the other thing, just to touch on what Kira was talking about there, which is just an important detail that I sort of want everyone to understand, with a healthy metabolism, with healthy insulin sensitivity, healthy metabolic flexibility, our default when we're at rest or engaged in light activity is fat burning. Fat burning is actually where we're supposed to be. And in a healthy state, we should really only tip into more predominantly carb burning when we're engaged in high intensity exercise. As a caveat, we're always burning a mix of fuels. Like I don't want anyone to go away thinking we're only burning fat. It's always a mix, but it should be predominantly fat burning when we're healthy at rest. Yeah.
You know, I think the point there is you get these people that go, I'm going to burn fat, and they're like this tense and they're not enjoying the exercise. I have to go to the gym. I hate it, but I'm going to, that sort of thing, rather than going for a bushwalk or going for a walk along the beach and enjoying the walk and moving the rest of their body, not just their legs. And, the picture in my mind that is conjured is the blue zones. And I picture this, grandmother from Corsica climbing down the mountain steps for her love language, which is cooking for her family, and collecting the herbs and the vegetables out of her garden that's a little bit down the path and putting them in a basket and walking up. She's bent over, she's moved her hands and her upper body, and then she's doing the walking and carrying extra weight, and then she goes, and all of this is involved with a love, and I think if we could engender that in our patients to love while they're exercising, to really enjoy it, it's a major flip. Going right back to inflammation there.
Yeah. Can I just say too, exercise is not a punishment for anything we've done or anything we've eaten. Exercise should be joyful. And again, part of what we'll explore, but the whole body type or nervous system type, what types of exercise suit you so that they don't put too much stress on the body? Because some body types can go really hard early in the morning and they can handle that high cortisol. Other body types are going to really struggle. They're more sensitive to that morning high cortisol, and we'd be better off exercising in the afternoons. And just finding the exercise that you love. Absolutely. Bushwalking, hiking, gardening. My God, if you're talking blue zones, gardening is some pretty hard exercise. My body hurts when I'm doing gardening. But yeah, whatever's working for people, it's not, And I find for a lot of people too, and it's kind of getting away from naturopathic principles more into exercise phys, but also, socializing while you exercise is a big thing for some people. And that's incredible, especially for women, for our nervous system. We have all this research around being with other people being so great for our nervous system and calming us. And I think we forget that. And then we suffer alone thinking we have to do all this exercise by ourselves.
Yeah. Get a dog and exercise with it, or get a cat and watch it while you're exercising.
Something else I wanted to say about exercise, but keep going. I'll think about it in a minute.
Can I just go back to when you were mentioning fat? We've got different types of fat, brown versus white, and there's some research showing that you can actually change that. Have we got any more research on what we can do to effectively change to having more brown fat and therefore more of a thermogenic body type?
Laura, you want that one?
Well, there are lots of theories. I mean, the research around brown fat and beiging white fat into brown fat is, I think, all pretty new. I don't know, but Kira, I'd like to hear what Kira thinks. I don't think there's much sort of evidence-based, conclusive, this is something you can do for sure. I mean, it's only been like 20 years since we even discovered that adult humans have brown fat. Yeah. Before that, we thought only infants and hibernating mammals had it. So this is all quite new information. I mean, I think the research is clear that people who do have more active brown fat do tend to have healthier metabolism. Like they tend to be more insulin sensitive. Some of that's going to be genetics. Some of it's just luck. I mean, I don't know. I mean, there's different factors. What do you think, Kira? Is there any tried and true recommendations for that? Exercise is one way, potentially.
Yeah. Exercise, it's definitely genetic. carrying fat is so, let's be honest, carrying fat is so genetic. It's, and it's also, have you turned on those genes that are, your body's starting to store more as well. So it's genetic lottery, and then how well you keep some of those genes turned off or not. But with brown fat, the one thing that comes to mind is cold exposure. But I went down a rabbit hole on this the other day. How much research we have on females and cold exposure versus males is also questionable. And I like cold exposure. I like the idea of it. But again, we take ideas and then we go so hard with them, and we do it all the time. And I would question for the female physiology. And there are people pointing out too cold might be too much for a female body, or, we might not need to be as extreme as we think. But I don't know how much deep research there is on that yet. I think that's kind of up and coming. But I would, it's just like people talking about fasted training. Fasted training, exercising in the morning while fasted, yes, you hypothetically will burn, we know you'll burn a few more grams of fat, but eating before training actually helps stabilize cortisol. Cortisol will not go as high during training if you've eaten a little bit, especially carbohydrate before training, but protein can work. And there are theories that, especially for certain body types who are more sensitive to cortisol in the mornings, it might be better eating before training, just a little bit something to attenuate that rise in cortisol so the body's not freaking out all the time that, it's starving. So, oh my gosh, it's a little bit of everything works really well. But as humans, we're like, more is better. And then we dig ourselves a hole, I think is really where my opinion is coming to.
So is this what you're going to be covering in your webinar? You're going to be covering different body types, different genetic types, obviously, and then how there are commonalities between that we all should do. And then are you going to branch off into how that body type, for instance, a gynoid body type might be better served by a certain type of exercise and perhaps eating patterns, and then an android type body type might have a different set of specific regimens to stick to?
Lara?
Well, the body types we're going to touch on, and it will just be part of the webinar, is actually the PH360 sort of 6 body types, which are more based on kind of an expanded version of the ectomorph, mesomorph, kind of endomorph types, but from a female perspective in our case. And so but the webinar is a half-day webinar. We're going to it's a closer look at insulin resistance and how to assess that and how to treat that and recover. And Kira's going to talk a bit more about the metabolic flexibility. She's just been describing this sort of moving this, what's called sort of a crossover point between burning fat and burning carbs, and basically being able to stay in fat burning for more of the time, or predominantly fat burning for more of the time, which is beneficial for metabolic health and just for feeling better too. So it's not just about, it's definitely not just about obtaining a certain body composition or anything. I mean, I really don't even really like the term body composition. I think it's about having energy and feeling good and having a reduced inflammation, reduced risk of heart disease and all the downstream consequences of insulin resistance if it's not addressed. And for everyone listening, insulin resistance or pre-diabetes is 100% reversible. So it's going to be a little bit different for every person in terms of how long that takes and what strategies they want to employ. There really isn't a cookie cutter one size fits all, which is why we need a half a day webinar to explore it. And of course, it's also the topic of my new book on metabolic health. So I'll be drawing on some of the things I learned when I was writing that book.
Yeah. And where
can we go into therapy? Oh, sorry, you go.
Yeah. So it's, body typing is only one little thing we're going into, because it's, it's a little lens that we have to, look at between each person, because it's not one size fits all. But, I'm the numbers girl when it comes to our lectures, of doing much more like, we're looking at macros, we are going to look at calories, because you can't not look at fueling a body, not calorie counting per se, but we're going to look a lot at how the physiology of the body is operating in insulin resistance, or when somebody is moving away from it, and the things we need to be doing to get there to a more, a better state rather than insulin resistance. So we're very much not teaching just the science. We're teaching or presenting very much what to go do with this, right? You need something to go do rather than just learning the theory.
Let's go into what we can use alongside our exercise and our diet therapy. What do you find most to have merit? Things like, for instance, polycystic ovarian syndrome with, using myo-inositol, for instance. Now, Professor Annabelle Teed basically dismissed myo-inositol in her, I've got to say, it was a fantastic podcast on polycystic ovarian syndrome. This was a medical one. And I suspect, though, that one of the reasons she dismissed it was because many of the supplements out there that have myo-inositol in them have a paucity of dose. They have, a few 20s or, scores of milligrams, or maybe a couple of 100 milligrams. But I've seen gram doses of myo-inositol being employed. Where do we go here?
Well, I could speak.
Lara.
Yeah, go ahead. Yeah, I mean, inositol is quite an important supplement for metabolic health. I'll just preface it, though. I'll just say, again, it's kind of a bit of a paradigm shift around this, but I guess my key message around metabolic health, and I explore this in my book, and I'll explore this with Kira in our webinar, but it's not separate from general health, right? Like it's really not. It's not like we've got the things we need for it to be, to feel good and have energy and have general health, and then the things we need for metabolic health. They're one and the same. So this is where the troubleshooting approach comes through in my book. I'll explore that a bit in the webinar as well. Like you really do, fix your health and you'll fix your metabolism. This is like similar to the principle